Hi, welcome to the Chinese Medicine Podcast. I'm Marie Hopkinson. I'm a Chinese medicine practitioner, and today we're going to be talking about headaches and the pain that, how to alleviate the pain that you might get from a headache. So you've probably done this before when you've gotten the headache, maybe press your temples or going like that. You see people sort of lying, going like that on the desk because they're in pain, and our natural instinct sometimes is to actually press where the pain is, to press those pressure points. So you can see that I'm here in lovely, beautiful Melbourne. The Yarra River is behind me. It's a beautiful city. It's a bit cold outside, so I'm glad to be nice and cozy, warm inside. But let's get on with it today. So pain in our head, or headache pain, how can we alleviate that pain with acupressure? Now, what's acupressure? It's pressing the points, pressing the acupuncture points. So this is the main point you might have seen being used before. This is called Hergu, large intestine 4. So Hergu is just the pinyin, the Chinese name of the point. And that point is along the second metacarpal, which is your second finger. And if you feel that you've got a little bone here and you just kind of press in that sort of squishy space, you can use the thumb and your first finger like that and pressing in like that. So you're using the pressure of your finger under your hand to sort of push up a little bit, and the thumb then to press down into the point. Now the trick with this point, a lot of people say it's between the two fingers. It's more on, the channel is on the large intestine channel, which is along the finger side, not on the thumb side. So you need to have, it needs to be kind of more here, not here, not in the web of the finger. Now with all acupressure, what you should feel is like a tingly, a heavy and achy sort of sensation from pressing the points. Now, if you've ever had acupuncture, which is like needling the points, the acupressure should replicate that same kind of feeling. So you should have a similar feeling to acupuncture with acupressure. Now, for headaches, for pain in the head, sometimes you can just naturally find that you feel relief by just pressing the pressure points. You might have had like an Indian head massage, or some different kinds of massages where they press on your head. Scalp acupuncture is like just acupuncture points on the scalp. That's also utilizing the many pressure points that are on your head. Now, you can't press the points too hard in terms of like what would be the worst thing that would happen when you press the points too hard. Well, you get a bruise on that area. And before you got the bruise, it will probably feel uncomfortable, so you usually stop. The person would often stop pressing. If you get a bruise in that area, then once the bruise goes away, there's usually nothing else that's damaged there, unless this is just when you're simply pressing the points with your own pressure. Then there's nothing that you can you can't do too much damage to yourself. So you can press away. If you press the wrong spot, you're not going to put your body out of balance, let's say, by just pressing the wrong point when you're trying to do this. So it's worthwhile just to give it a go, give it a try, and see if you can alleviate the pain of your headache before you need to go and take painkillers. So acupressure works the best. It's the most effective for when you as soon as the headache starts, start the acupressure rather than waiting until it's like a throbbing, intense headache, or it's so bad. You may need more than just acupressure to stop it if it's been going on for a long time. And with everything on my channel, I always tell people, don't use YouTube as a replacement for medicine. So if you have a headache, there can be lots of reasons why you have headaches. Headaches can come because you're dehydrated. They can come because of caffeine withdrawal. There's lots of reasons. And if you want to know the reasons in Chinese medicine, I've got another video on that, so I'll put the link to that below. You can check that out. But also, headaches can be signs of serious health problems in our body, so serious problems. You could have a brain aneurysm, you could have lots of different problems in your body. And you won't know that the diagnosis unless you go to a medical practitioner, so an actual GP, your medical doctor. When you go to a Chinese medicine doctor, and they may refer you to a Western medicine doctor, that's the reason why, because they don't know, they don't have the ability to give you an MRI scan or whatever's needed to make the diagnosis. So if you're not sure, go and see your practitioner if you're not sure why you've got the headache. Or if your headache persists and it's not being alleviated, even with your standard kind of painkillers and things like that, then that would be a time when you'd go to a medical professional and get a diagnosis. Now, acupuncture can also be used to relieve headache, and there's lots of evidence documenting the treatment of headaches with acupuncture you can, Chinese medicine practitioners can treat the pain of the headache at the time. Now, there's lots of different ways they may go about that. Sometimes they may put some needles in your head. Excuse me. They may put some needles in your head. They may put some acupuncture points in your body, in your hands, feet, legs, arms, that kind of thing. Sometimes acupuncture is used along the neck and the back, like the upper back, to alleviate that tightness and then free up the flow of blood to the head, because that's often the cause of many headaches, is just musculoskeletal tightness. But we're mostly focusing on what you can do for your own self today in treating headaches. So you've got pain in your head. You can basically just palpate your head. And I suggest you do this technique where you put your fingers on your scalp somewhere, and you basically just move back and forward. Now you can see with as I'm moving, my hairline's moving back and forward. That's because we have our skull, and then we have the skin that's on top of that, and the hair coming out of our skin. And so you'll see that as I'm doing that, I'm actually moving. The skin is kind of moving, being manipulated over the bones. Now, your skull bones can move a tiny bit. You won't feel them move by doing this, but your skull isn't one big bone. It's lots of bones that have basically fused together like this. And this is where, when you do like if you see a craniosacral therapist, they often do treatment where they're slightly, even chiropractors are slightly manipulating those bones, or just affecting, like in what we call the sutures, which is where the two aspects of the bones. I'm using my hands like this because if that's kind of what it's like. And so what you'll see is, or what you'll feel in your head, is a little divot, like sometimes you feel a little line. So if you're not sure, you can just run your fingers down and going back and forward, and you might feel, I can feel a little divot in there. And so often along those lines are where many acupuncture points are. And often you'll find in your head that there's one or two spots that feel incredibly painful when you've got a headache. Like you might press and you might feel, that really hurts. But at the same time, it's like a good feeling. It feels like a good pain. So what do you do with that? Well, often it's like acting like a little trigger point in your head. You can press it, just like I am now. I'm just basically using one finger or two fingers to kind of just press in on that spot, press it in. Maybe if you want to go even harder, like make it stronger, you can manipulate your fingers. I'm doing this very obviously, but just kind of like this, back and forward, sort of in those spots. And often with these kind of pressure points, you need to hold them for a bit of time. So let's say your head is throbbing, you're in a lot of pain. You can kind of press the points like that. I'm mostly using my thumbs there, but I'm just resting my fingers on there. If your thumbs get tired, you can use the knuckles of your thumbs there at the side, so you can kind of just press in there. And the other point that's often used is just at your temple. So this is one point here on your gallbladder channel, gallbladder 1. But just back from that, you have this soft area here. Now, just use the pads of your fingers really gently to kind of just massage in there. And you shouldn't feel any kind of tight or pain or anything like that with just that gentle pressure. But you can press in a little bit harder. Now, you don't want to press this too hard, because you certainly wouldn't want to press, don't press too hard, but you can just press gently. A lot of people like to combine acupressure with essential oil use. So the oil that I would recommend you use for headaches is lavender oil. Now, if you're allergic to lavender, or you've got other reasons why you can't use lavender, then don't use it. But you can just use a carrier oil, which is like, you could just use cooking oil out of the cupboard if that's all that you've got. A high quality olive oil is better than just standard vegetable oil. You could also use, in massage therapy, they often use almond oil, jojoba oil. Those kind of oils are nice oils to use on your skin. Soybean oil can be used. And so you're just using a little bit of oil to mix with the essential oils, and then apply that to those areas. So just like that. So that's the first one I would do on your face. That is called Tai Yang, Taiyang, and it's kind of just in that spot there. And then Yin Tang here. So the way you use this point here, which is just what most people would consider their third eye area. So just between your two eyes, at the bridge of, just above the bridge of your nose, Now, when you press here, if you just press, you can press with your thumb, you can press with your finger. It's not as effective as if you actually pinch it. So if you pinch that area, you're pinching the skin together, and it's actually more effective because you're really getting into that little bit of muscle that's there and pinching that muscle together rather than just pressing down onto the bone. So that's a little tip that will make that. So you can basically pinch, and on your face you tend to want to press as generally much lighter than on your body. So on here, on the Hergu point or any other points on your hands or feet, you can press a lot harder. Now on your face, one is you don't really want, most people don't want a bruise on their face. I don't want a bruise on my face. So press lighter. And also your face is more sensitive, your skin is a lot more sensitive, especially if you do have even more sensitive than average sensitive skin, then you can just press it very lightly. If you've got thinner skin, you don't want it to sort of tear your skin by pressing things too hard. So they're the first points I would start with. Is one is just massaging your own scalp like this, going around and just feeling, does that feel good? Is it kind of, some of the, oh wow, there's a really tight hot spot there. Oh wow, that really hurts. Okay, so find those little trigger points, and you can just press them like I'm basically just pressing into them, holding them. If I press two hands together or I press in it, and I can actually lean my head into my hand. So if I'm really tired, I could rest my hand on the desk and just sort of, and you see people do that naturally, just they do it because they're kind of in pain. It's just a natural way to kind of try to alleviate the pain. So that's a good thing you can try. The other ones you could do is on the back of your neck. So here, this is called Acupuncture, gallbladder 20. So just behind your neck. So how do you find that point on yourself? Well, okay, you go to your ear, and just if you feel behind your ear, you'll feel this bony protrusion sort of there, and then go a little bit further back, and you might feel that protrusion of the muscle in a rigid kind of way here. So that point's in between two muscles. Once your sternocleidomastoid muscle, or some people just call it SCM because it's got a really long name, and then your trapezius. So the trapezius is the one at the very back. I'll just turn around here so you can kind of see. You do it like that. Hopefully you can notice that. So if I turn around here, you can see that's the point there. So you can use your two thumbs in there. Now what I'm doing is I'm just holding here on my head a tiny bit, but mostly pressing in here. And another little trick is then to lean your head towards the point. And that's a super effective point to do, and that's called gallbladder 20. So that's a really nice point to kind of press right in there, and you can just get in there. Again, if you get the wrong spot but it's feeling good to you, you're not going to make it worse by pressing the wrong spot in those areas. And you might even feel that through that SCM, that sternocleidomastoid muscle, that you have a bit of tightness there. If it comes sort of around to the front here, you can see in the other video I made, I was talking about how different channels, like the stomach or the large intestine channel, how that kind of relates to different areas. This area here is the gallbladder area. In Chinese medicine, a gallbladder channel is relating to the Xiao-Yang channels, and the other Xiao-Yang channel is your Sanjiao channel. So if this is relieving the pain and you're feeling better from pressing that, the other aspect then you want to press is on your forearm. So how do you find that? So just the middle between these two bones, you can just massage that channel up and down here. So there's a lot of points here. So right in the middle of your wrist, that's one Sanjiao point, Sanjiao 4. The main one you probably want to use is Sanjiao 5, which is 2 fingers spaced apart from the Sanjiao 4 sort of here, and then a little bit further up. Now, don't be worried so much. More go for the channel. So you can just rub the channel. You can just literally just rub your thumb up and down. You can, what in Chinese medicine they call tambo, which is like strumming across, pressing across. The other one that I really like to recommend to people is, let me see if I've got a little pen or something on this desk. No, I don't. But what I do have are my keys. Oh, I do have the pen. There's a pen in this hotel room. Here we go. So here's a pen, just a standard pen. Okay, so we don't have anything else. So one is you can click it down so that you just have the blunt end there. Now that's not too sharp, but you can use that as a little presser. Now you're not poking it into the skin, but you're just using that as a little thing to kind of press into the point, and you'll get a very little pen mark on you, just a circle pen mark. Or often the blunt end of the pen is a good one to use. So this has got the thing that presses the pen up and down. It's going to do that when a clicking sound as I go along. But that's really effective. You can even do that if you want. If that clicking sound doesn't annoy you too much. And sort of do some massage like that. And that brings me to the other aspect, which is the bird pecking. So I'm going to go down sort of the Sanjiao channel, which is kind of like going down my arm. And if you're not sure where these channels are, just Google them. It's not that hard. Sanjiao, S-A-N-J-I-A-O, Sanjiao. It's also translated as triple warmer or triple heater. And then the other one is your large intestine. So this large intestine 4 point. And if you're really interested in knowing about, well, why do those things relate to headaches, you can go and watch that headaches video, the one I'll put in the description below. It's a bit more long-winded, more about the Chinese medicine understandings of it. And then you could just grab a key or something and just use the key to press into the points. That's another thing you can do. Acupressure is quite commonly done through the clothing. And so then you can use an implement like you can do with your thumb or your hands through the clothing. So I hope this video has been useful and helpful to you. If it has, then I encourage you to go and seek help with a Chinese medicine practitioner if you've got ongoing problems with headaches and you want to see if you can find a natural way to treat it. Lots of people look for natural ways to stop pain because they want to get off painkillers, or they just don't want to use painkillers on a regular basis. So there's nothing wrong with Western medicine. Like in Chinese medicine, a lot of practitioners, would use Western medicine on themselves or use Western medicine in some cases. And lots of patients who use Chinese medicine use Western medicine as well. But the issue with chronic pain problems is when you're taking painkillers all the time or having to take them so regularly, they can have an impact on your digestive system, on your actual digestion, so your stomach, especially anti-inflammatory based ones, or the issue some people have is just being overloaded in their kidneys or their liver because they are working overtime all the time, and they might be at the point where they've maxed out on painkillers. Sometimes people get headaches, they've already got another chronic health problem, which just means they're taking a lot of painkillers already, and then they get this other issue and they can't just add in more pain medicine. So go and see your Chinese medicine practitioner, your acupuncturist, a registered acupuncturist or herbalist, and that way you'll be able to get that specific diagnosis. So these points are all just kind of very general, generic points. And when would these be useful? Maybe if you're traveling and you can't get to a practitioner because you're on the airplane or something like that, you're stuck in the airport, you've got a headache. You're in a meeting and you just can't get out of that meeting at that moment, and you want to try to relieve that pain if you can. Then these things can be used to help. And finally, the other tip I would give people is try a hot pack. Now, often you go for cold. You can try either a cold or a hot pack, but heat expands blood vessels, makes blood vessels expand. The best place to put the hot pack is on the back of your neck or on the top of your head. And so if you try sometimes I even put the hot pack on my forehead. And what that does is it just makes blood vessels expand, and then that can often alleviate the pain, and at least you can get some symptomatic relief for a little while. So I hope that this video has been useful and helpful to you. I look forward to seeing you again on the next episode of Chinese